24 hours a day.
You're frightening Central Illinois. WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube. Brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest in studio, Paul Skowron, CEO of Warner Hospital and Health Services. Morning, Paul. How you doing? You staying cool out there?
Good morning, Seth. Here we are with our projected sixth day of 95 degrees to be hit. I'm doing my best to stay cool, drinking a lot of water. Yes.
So what's the crowd like with the hospital right now? You getting a lot of heat related things?
There's clearly an uptake in heat related. Some in the ICU are pure heat exhaustion, but in the emergency room, pure heat exhaustion. But a lot of it is heat related, nausea, and things that people feel like they're faint and things like that, and people that might have conditions that would get worse when it's this hot for a long period of time. It's showing up in both the walk-in clinic and the emergency room.
Okay, so when it comes to the heat stuff, I mean, is it just mostly rehydrate, IV fluid, and they're on their way?
Pretty much. That is 75% of it.
Yeah.
An additional increase is those that have cardiac related issues that if they're ignoring all these things we just talked about, drink a lot of water and cut back on your physical activity, then there's those things. But that's why we have an emergency room and
no doubt
relationship with bigger hospitals to be able to transfer folks when needed.
Very good. Very good. So keeping you busy with the heat there at the hospital. And I drove by the other day, Paul, and noticed the west side entrance looks like it's done. Are we done over there?
We are done. We simply can't allow the public to use it yet because we have applied to Illinois Department of Public Health for a permit. We've applied for an expedited permit because there's not a lot of life assisted issues with the specialty clinic. It's not like waiting for the emergency room to get approval. There's simply the access doors that have to be approved and things like that. So we're hoping within a week, 2 at the worst, we'll get our approval from IDPH.
Yeah, sure. Remind us, West Side Access, what's at Access and all that.
So it's the specialty clinic where we 2 years ago knocked down the housing and built a new parking lot. And then in this last year had been working on, we blew a hole right through the west wall there and created a new door and a concrete ramp and with safety rails and so forth, so that wheelchair access is not an issue whatsoever. And folks will no longer have to walk through the main entrance of the hospital, take the elevators upstairs, and walk through the inpatient bed side to get to the specialty clinic. They'll be able to park and walk about 25 feet right into the specialty clinic from the west side of the hospital.
All right, very good, very good. So looking forward to that, and of course the new parking lot, Paul. Is it in use at this point, or will we see a lot more traffic once that west side access is opened up?
It is in use by the providers, by the specialists that come to the specialty clinic, and we've got our electric charging stations. That's only 4 parking spots. So some people and providers have been accessing that, but there's still an additional 20 parking spots waiting for the patients to be able to use them.
What was the cost on that project?
It was $650,000.
Not bad.
Yeah.
For all that, new signage looks nice. Overhang is going to be real good to get out of the sun in a jiff and get inside. So
that's right. Or the rain and all that stuff.
Yeah, snow and all the elements. Definitely. Now, if I remember right, wasn't kind of the vision to have that enclosed at one point? Am I remembering that right?
That was an additional $1 million we would have had to spend. Yes, the first draft of this was to have it entirely enclosed. And to do that would have required ripping up some real fundamental pipes, electric and gas pipes underneath.
Is that where most of the cost for that came from?
That's where the cost came from. So the concrete reinforcements that would have had and steel that would have had to been put underground to make that happen. We just couldn't justify that kind of cost.
Sure. Very good. But awaiting IDPH approval, and that will be up and running. So is it ADA accessible and all those things?
That's what the ramp is for. And that's the only part that is really requiring IDPH approval. You're right. ADA accessible.
Very good. So hopefully we get a good word on that here soon.
That's right.
Yeah, very good. Anything on that west side access, Paul, we haven't touched on? I know it's been a long time in the making. Got to be nice to have it finally done, and just one last I to dot and T to cross.
Well, simply you mentioned that you saw the sign. So that's the other part we're really happy about, is that as you're approaching the hospital and driving east on 5410 there, you can see the words specialty clinic, so you know exactly where you need to go.
Very good. Excuse me. So check that out. Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio here for this morning. Paul, I know a lot of watch in Washington right now as the budget process plays out in the district, and potential cuts to, gosh, it feels like cuts and funding for a lot of things really in jeopardy. I've seen senior services, farm bill, the farming stuff, the ag stuff. Medicaid among that as well. Concerns about the future of Medicaid funding. What can you tell us? What's this all about?
So Medicaid is our specific concern, and our board at our board meeting last Monday was concerned and asking whether or not we're already doing calculations to try and estimate the effects. And they know, and we all agree that this is not a done deal, but it is being discussed. And of course, with the first pass, there is potentially some severe cuts to Medicaid. So as a critical access hospital, as a rural hospital, we have to think about how much Medicaid do we have. We are fortunate that I've always called us rural light, in that we are right in between the towns that have employers that a lot of residents from DeWitt County go to. So the employers like the state farms and the large employers, the university in Bloomington Normal, the employers in Decatur, the Springfield, Champaign, and so forth. We're right in the middle of all that. And therefore, we've got a lot of residents with good insurance, not Medicaid. So we are about 20% Medicaid on the average as the year goes. There are many smaller rural healthcare hospitals in southern Illinois. Let's just say, use a line and say south of the St. Louis area, that only have a couple of large employers. So they have a 50% on average Medicaid population. So they're really concerned about how these potentially severe Medicaid cuts are going to hit them. We've calculated at this point, with what we know, that there would be about a 3% reduction in our bottom line, in our profit, if the existing Medicaid cuts were to be enacted.
Is that a number you have in your head as to that exact dollar figure?
It's a number that we've calculated, and we've used the Illinois Hospital Association's formulation based on our Medicaid population as an estimate.
What's that estimate for our hospital?
Well, it's 3%.
Okay.
So that could be $60,000, $100,000.
Okay.
If we look at it, worst case scenario, it could be up to $250,000 hit. We have to factor all this in and start rethinking about our future budgets. And so I'm kind of taking the summer in preparation for the next budget to take a more macro view of the future and look at our operational expenditures and our capital budgets, and maybe temper them and not be so aggressive with things we might wanted to do. So we will review the 3-year capital plan, and I might think further out into 5 years and think about what should we look like in 3 to 5 years, given the current administration in Washington.
Right. Sure. With that said, sounds like a letter of support to not make those cuts went out. Do you mind speaking to that a little bit?
Yes, we did urge our congressman, and both in the federal government and in the state. As a matter of fact, our new mayor Helen Michelasi has just recently met with some of the state reps, Bill Hodder, and Ms. Turner and so forth, and Sally Turner,
Mm-hmm.
and talked about many things from a city perspective, but she's also emphasized concern about any Medicaid cuts, and anything they can do to help us would be appreciated.
Yeah, sure.
So we appreciate her hitting the ground running as the new mayor on these issues.
Is Medicaid a matching program from the federal government? Am I remembering that right?
Yes, and that's where states like Illinois are more concerned than some that did not access all of the federal government's subsidies, but Illinois did, and we took on all the new Medicaid patients that we could in the past 4, 8, 12 years, ever since Obama legislation. And that was good as long as the federal government was providing 55% subsidies to giving more people access to healthcare. But now with their clear intention to reduce the federal budget and hopefully, reduce their deficits, they're looking at these kind of programs and saying we're going to cut back on them, and cutting back over time is good, but some of them would like to do it like in 1 year.
Mm-hmm.
So that's where we're concerned about severe cuts and reducing access to care for people.
Got it. And I don't know how much you want to dive into this, but it oftentimes feels like sometimes these are pawns in the game of politics.
That's what it is.
Yeah.
And so every constituency, and we're in healthcare, has to advocate for themselves as strongly as they can.
Sure. Yeah. Well, and I guess to that end, what is there like a timeline of, because don't they have to budget by like what, October? Am I remembering that right?
At the very, very latest. That's when it goes into effect.
Yeah.
President Trump and House Speaker Johnson heads, their self-imposed July 4th. They were hoping to have a bill done by then. Highly unlikely, but it does give them the next month or 2 months to get it done. But they want to get it done sooner than later.
Yeah. Why not just wait and see what happens? If you don't mind me asking.
Oh, well, there's our budget's in place.
Right. That's exactly. Yeah, that's what I mean. So why not just wait?
We're not doing anything drastic right now.
Okay.
But we're talking about future budgets.
Okay.
So let's, we're making sure that we're budgeting and planning for the worst and hoping for the best.
I see.
But always plan for the worst.
Yeah. You mentioned, Paul, maybe not taking on some things, putting some things off based off of projections and such. What does that look like for the hospital?
So what if we wanted to expand the wellness center, which has always been on our list of things to do? Maybe we can't be so aggressive in using that green space that we have, where we had bought properties in the past and bought them for potential future use. If that's going to cost over $500,000 to do something like that, we have to really look carefully at what is the future benefit of expanding that. Will we be able to put programs, healthcare related programs in place that will generate revenue that we can bill for, that will compensate for those expenditures? Some of that is questionable. So we've got to take a hard look on maybe there's other areas that our money would be better spent. Maybe working with our partners to bring more specialists into the specialty clinic now that we have more access, and provide care in that respect.
I see. Very good. Anything else on that, Paul, we didn't touch on?
No, sir.
All right. Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio. More to come with Paul on the morning show.
WHOW.
Let's check the opening numbers now at the Chicago Board of Trade on this Thursday. Jim Taylor on the RFD Radio Network. A steady start with corn, beans, and Chicago wheat. July corn opening for 11.5, up 1 1/4. September corn up a penny, 4.06, and December corn 4.23, up 0.5 penny. July beans starting the day 10.26 up 3/4. August beans up a penny 10.30 1/2. November beans 10.19 3/4 up 1 1/4. July wheat 5.27 1/2 down 1 1/4. September wheat down a penny 5.43 1/2, and December wheat down a penny 5.66 1/2. July bean meal 273.40 down 2.60. July bean oil up 36 cents 52.18. Looking at the opening numbers at the Chicago Board of Trade on this Thursday morning, I'm Jim Taylor. You're listening to the RFD Radio Network.
Looking for a new Silverado? This is Scott Baum from Baum Chevrolet Buick here in Clinton. We have a good selection of new Silverado inventory. We have Silverados in 1500s, 2500s, and 3500s with several trim levels, custom, LT, RST, LTZ, and yes, even high countries. All our inventory is priced for our summer savings season. Baum Chevrolet Buick. Together, let's drive. BaumChevroletBuick.com right from the start.
Symptoms can't wait? We have the solution. CEO Paul Skowron here from Warner Hospital and Health Services in Clinton. Come to our walk-in clinic inside our family medicine. No appointment, no problem. See our icon at DeWittDailyNews.com.
DeWittDailyNews.com is the area's leading local news source 24 hours a day, 7 days a week. Get the latest local news, obituaries, police blotter, weather forecast, and more with no paywall. Head to DeWittDailyNews.com to get the local information you need to know.
Your friend in Central Illinois, WHOW.
Once again, good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio for today. Paul, I want to go back to the Medicare conversation and the possible cuts coming, and how that, I guess, speak to how that would impact. I know you touched on it a little bit towards the top of our conversation there, but remind us how that would impact rural healthcare facilities, and maybe why Warner Hospital is maybe just a bit immune to some of these cuts and discussions coming down the pipe.
Well, we talked about 20% Medicaid, but 50% of our population at the hospital is Medicare, and that's a well-funded program. But overall, we have prepared well over the last 10 years with good annual profits and putting money in the bank and getting some good interest on all those funds now. So we've built up a war chest that is going to protect us from most of these cuts. But we never want to get complacent. So when I say we're rethinking future budgets, we are in a good position, and we will remain profitable even if these Medicaid cuts are enacted, because we've prepared for this. That's what I really meant when I said prepare for the worst. We've been doing that over the years, but we don't want to get complacent and have any surprises. So
no services or anything like that.
That's correct.
Yeah.
We have prepared to make sure that doesn't happen at Warner Hospital.
Yeah. Well, one of the ways you prepared, and I know that this is always something you're kind of always working on and just pursuing, is, making sure that care is available, whether it can be provided in Clinton or elsewhere for patients. And I know you recently went up to Bloomington for the grand opening of a expanded facility there. Tell me about that and just kind of how that relates and why that relates to Warner Hospital.
Yeah, our partnerships are so important, and we've got our partnerships in specialty care with Gibson Area Hospital, but our expanded emergency room has the capacity to transfer more patients, see more patients, and when necessary, transfer more patients after we've stabilized the patient for strokes and things like that. And in the case of when COVID happened, all of the smaller hospitals were trying to transfer people to other hospitals and their ICUs, and those hospitals' beds were full. No one had any room. We ended up transferring even a few patients out of state, and we never want to see that again. And so the larger hospitals have taken note of that, and St. Joe Hospital, the OSF hospital in Bloomington, specifically has prepared for this, and they just opened their new 25 bed ICU expansion. And I was invited by the new CEO for St. Joe, Unmi Shim, to the blessing on last Tuesday, June 17th. And it was really great to see. The point is that they are now able to handle a lot more transfers when it occurs, when the need is there. So I was really glad to be invited to see in person and talk to the staff that are going from the old ICU to the new ICU as they're ramping up and hiring all the staff they need to be able to man all new 25 beds and be prepared whatever might come up in the future.
Mm-hmm.
But it's that kind of a partnership that we really rely on.
Mm-hmm.
The hospitals in Decatur and Springfield, we have transfer agreements with all of them. But OSF St. Joe is one of the closer ones and has been really a bedrock of support for us in terms of being able to transfer patients to an ICU.
Sure. Yeah, those are vital, really are to making sure that whatever a patient comes to you with, whether, again, you can care for them or you need to rely on those partnerships. That's why you're, always reaching out with those folks, I'm sure, is to just, keep your hospital and your facility top of mind for, folks that are coming their way.
That's been part of our success.
Yeah.
We cannot be an island.
Very good. Paul, let's wrap up with, I got a couple of minutes yet still. Give me an update on electronic medical records, that process. What's going on?
So what is, it's under the radar for the public, but it is the largest expenditure in the last 4 years on any one project is we have a Meditech system, and we're upgrading to their Meditech Expanse, the latest version, that will make us compatible with all the larger hospitals. And we just had a visit from Meditech yesterday, and they checked off all the boxes and said, you are on course for your November 1 go live. And the public won't see much of that except for access to care, where they'll be able to use their phones and schedule appointments, where they will have immediate access to the results of the tests that are done, like they can do at the larger hospitals, and communicate with their providers.
Yeah.
So internally, it streamlines the work for the providers, and it makes it easier to recruit both clinicians, nurses, and providers when they see we've got the same systems, electronic health records systems as the larger hospitals.
Yeah, convenient for everybody. Win-win-win, if you will.
Indeed.
Yeah, very good, very good. What's the cost on that? You said it is the largest expenditure.
1.8 million.
1.8 million. Goodness. All of that for continuing the development of those electronic medical records. It feels like that's a never-ending process.
Indeed. It's like so much technology. It's unfortunately being upgraded quicker and quicker.
It sure is. Paul Skowron, thanks for your time, Paul. We appreciate you. Paul Skowron, CEO of Warner Hospital and Health Services. Network News is now.